The pituitary is a pea-sized gland located in the middle of the head under the brain. It lies in a bony depression in the roof of the sphenoid sinus known as sella turcica. Only a thin bone of 1 millimeter thickness separates the pituitary gland from the sphenoid sinus. It has two lobes, anterior and posterior, and these secrete a variety of hormones which controls all the endocrine glands in the body and regulates growth and development, sexual function, metabolism, the stress response, and water and electrolyte balance, and therefore it is known as the master gland. Pituitary tumors are almost always benign. It affects the patient in three ways. 1. Some of these tumors produce in excess of a particular hormone. When growth hormone is secreted in excess in adulthood, it causes acromegaly. If that happens during childhood, it causes gigantism. When stress hormone ACTH or cortisol is secreted in excess, it causes Cushing's disease. When the hormone prolactin is secreted in excess in men, it can lead to lower sex drive and erectile dysfunction and production of breast milk. In women, it causes menstrual problems and infertility. Some of these tumors do not produce any hormone. This slowly growing tumor compresses the normal pituitary tissue and prevents its normal secretion. Symptoms of hypopituitarism depends on which hormone is deficient and may include short height, infertility, intolerance to cold, and fatigue. The third is the pressure symptom. When the pituitary tumor enlarges, it causes headache and it compresses the optic nerve, resulting in visual impairment. Initially, the patient loses the peripheral vision, which progresses slowly to complete loss. The optic nerve from the eye passes just above the pituitary gland. When the pituitary tumor enlarges, it compresses the optic nerve, resulting in visual impairment. For prolactinoma, medical treatment is the treatment of choice. Surgery is done when the medical treatment fails. For all other tumors, surgery is the treatment of choice. In most of these tumors, surgery can be done endoscopically through the nose without opening the skull. Radiotherapy is given for residual or recurrent tumors. Medical treatment is given for recurrent secreting tumors. In endoscopic pituitary surgery, ENT surgeons and neurosurgeons work as a team. Most of the pituitary adenomas are removed via the nose using endoscopic endonasal technique. Endoscopic pituitary surgery is done through the nostrils without any incision on the face or head. Rigid telescope connected to a high definition camera is used to visualize the structures inside the nose. As I mentioned earlier, pituitary gland lies over the roof of the sphenoid sinus. Using a specially designed long drill, the sphenoid sinus is opened and the bone covering the pituitary gland removed. Then the tumor in the pituitary gland is removed using special instruments. The aim of the surgery is to remove the entire pituitary tumor, preserve the normal pituitary gland, and remove the pressure on the optic nerve. To achieve all this without complications, we use various advanced equipments like high definition camera, navigation which acts like a GPS at the skull base, and endoscopic Doppler. Following are the scans taken before and after surgery showing complete removal of the tumor.